Prostate cancer is the most common solid cancer diagnosed in men beyond skin cancer diagnoses. Approximately 300,000 new cases of prostate cancer are diagnosed every year in the United States, and here in Australia, that figure is around 20,000. The burden of disease in Australia, it results in around 3,000 prostate cancer related deaths on an annual basis. In today's video, I wanted to highlight for you 10 of the warning signs that you may have prostate cancer. Hi, my name is Dr. Charles Chabert. I'm a urologist and the director of the prostate clinic located on the Gold Coast here in Australia. Please, if you get value from this video, consider subscribing to our channel and potentially giving us a thumbs up for this video. So if we look now at some of the warning signs, let me start by saying that the challenge that we have with prostate cancer is predominantly it grows in an area of the prostate that is away from the outlet pipe of the bladder. So if I just revisit the anatomy for a second, we have the bladder which sits on top. Below the bladder is the prostate. The prostate is shaped in essence a little bit like a donut in that there's a hole in the middle and we pee through that hole. One of the challenges that we have is as we get older, the prostate grows and can block off that tube. Anytime there is compression of the outlet pipe of the bladder, there can be urinary symptoms which develop pursuant to that. The majority of prostate cancers tend to occur in the outer part of the prostate, so they occur very close to the shell. The implications of that are that a prostate cancer needs to be of significant size before it can actually impede the outlet pipe, the urethra, the outlet pipe of the bladder, and actually cause urinary symptoms. So for many men, prostate cancer is an asymptomatic journey, and the way that we detect prostate cancer is through screening with a PSA test and a DRE. That being said, some symptoms can be associated with a prostate cancer diagnosis. So what can happen if there is compression of the outlet pipe? To begin with, men can notice that they go more frequently. So their frequency to urinate both in the day and at night can increase. Number two, it's possible that men can have a degree of hesitancy when they're trying to pee. And hesitancy basically means you feel like you need to pee, you go to the loo, and it takes you a while to actually initiate a flow despite the desire to have a pee. The flow itself when a man is peeing can be a little bit interrupted. And many men report to me that they pee, they stop, they start again, they stop, and they have this interrupted process for a longer period of time. Occasionally, men can experience some stinging or burning when they pee. However, for the majority of people, if there is a stinging or a burning sensation that accommodates peeing, for the most part, these men can have some kind of inflammation or potentially an infection. Certainly, if you have stinging or burning, that without doubt is an indication to go and have a chat with your local doctor to have things evaluated to make sure you don't have an infection. And to further on that point, infections are rare in men. Men have a longer urethra or a longer outlet pipe to the bladder. And because of that, without getting into too much detail, because of that, infections tend to be rare unless there is some kind of plumbing restriction or obstruction to the bladder that causes or promotes retention of urine. Another sign that you could be dealing with an abnormal growth in the prostate is the presence of blood either in the ejaculate fluid, so in the semen, or alternatively blood within your urine. Should you see either of those, this is a hallmark feature and an indication that you need to go and see your local healthcare provider to be checked. The erection nerves, so the nerves that supply the penis, and allow a man to have an erection, these nerves are actually adherent onto the back surface of the prostate. And on occasions in men, if they have locally advanced prostate cancer, we can see that the cancer itself grows from the prostate to these nerves, and that can result in a reduction in the strength and the durability of erectile function that men are experiencing. Now, it's important to note that changes in erections for the majority of men are related to what we call vasogenic risk factors. So, in essence, anything that increases the risk that a man could be developing hardening of the arteries, blood pressure changes, cholesterol, sugar changes, carrying excess weight, exercising less frequently than before. If a man does experience erectile changes, it's really important to go and get that checked out with your local doctor, because it could be the canary in the coal mine with regards potential coronary artery disease. So if there is hardening of the arteries in the very small penile arteries, it's possible that there could be hardening of the arteries in the coronary arteries, or the arteries that supply the heart muscle. Another sign that we could be dealing with an abnormal growth in the prostate is painful ejaculation. So that's a change in the quality of someone's orgasm that is now causing them some pain that they may experience in the perineum, which is that space behind the scrotum. Sometimes they can feel it also in the lower part of the abdomen behind the pubic bone. Like all cancers, they start in one place and they have the ability to grow and to spread and to disseminate to other parts of the body. And that's really one of the characteristics of a cancer. With prostate cancer, it tends to spread in three different ways. It either grows through the shell to the local lymph nodes, or it can spread to the bones. If it does spread to the bones, prostate cancer can cause pain in that location, and that can present with back pain. Sometimes men can also present with a loss of weight, an unintentional loss of weight. So they can feel a bit washed out. They're losing several kilos unexpectedly over the preceding few months, and that can be associated with some pain. Weight loss, systemic features, in addition to bone pain, was far more common in the pre-PSA era. Since we've had the PSA blood test, the probability of being diagnosed with metastatic disease that has left the prostate and gone elsewhere, is far less common. Still happens, but the incidence has been reduced. So to summarize, there are several features that are mainly related to a change in the way a man pees that can be associated with a new diagnosis of prostate cancer. It is important, however, to be aware that the majority of people that we see today actually present with no urinary symptoms at all. Hence why it's really important to talk to your doctor about having the PSA blood test in combination with a DRE. I hope you found this video helpful. If you've got questions or comments, please leave them down below. Until the next video, look after your prostate.